Ever wondered why some men frequent the restroom more often as they age? Could it be due to an enlarged prostate? Also known as benign prostatic hyperplasia, an enlarged prostate is a common condition that affects many men as they advance in years. This non-cancerous enlargement of the prostate gland leads to bothersome urinary symptoms. Consider the prostate gland as a donut, encircling the tube that carries urine from the bladder out of the body. Now imagine that donut getting bigger. The bigger it gets, the more it squeezes that tube, making it harder for urine to pass through, resulting in various urinary symptoms. It's crucial to realize that an enlarged prostate is not a sign of cancer and doesn't raise your chances of developing prostate cancer, but it can significantly affect a man's quality of life. Understanding the condition is the first step towards seeking the right treatment. Now we can explore the various treatment options available. First on the list are lifestyle changes. Yes, tweaking your daily habits can significantly impact this condition. Let's dive into the nitty-gritty of how you can adjust your lifestyle to manage an enlarged prostate. Let's start with your evening routine. If you find yourself waking up frequently in the night to use the restroom, consider lowering your fluid intake in the hours leading up to bedtime. This doesn't mean you should drink less water throughout the day, but rather time your hydration. Aim to consume the bulk of your fluids in the morning and afternoon. A hydrated body is a healthy body, but timing matters. Next, let's talk about what you're drinking. Alcohol and caffeine can stimulate the bladder and increase the urgency to urinate. If you're a fan of that morning cup of joe or enjoy a cold beer after work, you might want to reassess. Try cutting back or even eliminating these drinks from your diet and see if your symptoms improve. Everybody is different, and what works for one person might not work for another, but it's worth experimenting to see if these changes can help. Now let's move on to physical activity. Regular exercise can do wonders for your overall health, and your prostate is no exception. It's not about running marathons or bench pressing twice your weight. It's about consistency. Regular, moderate exercise can help reduce symptoms of an enlarged prostate. Whether it's a brisk walk in the park, a relaxing yoga session, or a quick swim, find an activity you enjoy and make it a part of your routine. Lastly, maintaining a healthy weight can also help manage an enlarged prostate. Extra weight can put pressure on the bladder and cause increased urination. Eating a balanced diet and getting regular exercise can help you maintain a healthy weight and reduce pressure on your bladder. Sometimes simple changes in your daily routine can lead to significant improvements. Remember, your health is in your hands, and little steps can make a big difference. When lifestyle changes aren't enough, medication steps in. As we navigate the path of enlarged prostate treatments, it's important to understand the role of medication in managing this condition. The realm of medication for enlarged prostate is vast and varied, but let's focus on two main types: alpha blockers and 5-alpha reductase inhibitors. These are usually the first line of defense prescribed by healthcare professionals when lifestyle changes alone don't cut it. Alpha blockers, don't be intimidated by the name, are pretty straightforward. They work by relaxing the muscles in the prostate and bladder neck, allowing urine to flow more easily. This doesn't reduce the size of the prostate, but it can significantly relieve symptoms. Some commonly prescribed alpha blockers include names you might have heard tossed around: tamsulosin, alfuzosin, and silodosin. On the other hand, 5-alpha reductase inhibitors take a different approach. These medications, with names like finasteride and dutasteride, actually shrink the prostate over time. They work by blocking the production of a hormone that contributes to prostate growth. It may take several months to feel the full effect, but patience is key here. Now you might be wondering, what if one type of medication isn't enough? That's a great question. Sometimes a healthcare provider might recommend a combination of an alpha blocker and a 5-alpha reductase inhibitor. This combo can be more effective than either medication alone. But, as with any medication, there can be side effects. With alpha blockers, one might experience dizziness, headache, or fatigue, while 5-alpha reductase inhibitors may cause decreased sex drive or sexual function. These potential side effects underline the importance of having an open and honest conversation with your healthcare provider about what's best for you. In the end, the goal of medication is to improve your quality of life, to reduce symptoms, to make you more comfortable, to let you get back to living the life you love. Remember, always consult with your healthcare provider before starting any medication. Medication can be a powerful tool in managing an enlarged prostate, but it's not a journey to embark on alone. Stay informed, stay proactive, and stay in tune with your body. Sometimes when medication isn't enough, your healthcare provider may suggest a minimally invasive procedure. This might sound a bit scary at first, but let's delve into what these procedures are and how they can help. One such procedure is called Transurethral Microwave Thermotherapy, or TURP for short. In this procedure, a special catheter that generates microwave energy is inserted through the urethra into the prostate area. The microwave energy heats and destroys the excess prostate tissue that's causing the blockage. The procedure is done under local or spinal anesthesia. It's an outpatient procedure, meaning you can go home the same day. And the recovery time is typically much shorter than for traditional surgery. Another procedure is transurethral needle ablation, or TUNA. This procedure also involves inserting a specially designed instrument into the urethra, but in this case it uses low-level radiofrequency energy, not microwaves, to burn away the excess prostate tissue. Like TURP, TUNA is also an outpatient procedure performed under local or spinal anesthesia. What's important to note is that these procedures are less invasive than traditional surgery. They don't involve any incisions or general anesthesia. This typically means less pain, less risk of complications, and quicker recovery times. However, as with any procedure, there can be side effects such as temporary difficulty with urination or sexual function. It's also worth mentioning that success rates for these procedures are quite high. Many men experience significant relief of their symptoms and improved quality of life after undergoing these treatments. So, while the names might sound a bit intimidating, transurethral microwave thermotherapy and transurethral needle ablation, these minimally invasive procedures are actually quite straightforward. And they can be highly effective in treating an enlarged prostate. Remember, it's always important to discuss all your treatment options with your healthcare provider so you can make an informed decision about what's best for you. And don't let the fancy names scare you off. These procedures are designed to help, not to intimidate. While these procedures may sound intimidating, they can be highly effective in treating an enlarged prostate. In severe cases, surgery might be the best option. Now that might sound a little daunting, but let's break it down. When we talk about surgical options, we're typically referring to procedures like the transurethral resection of the prostate, often shortened to TURP, and prostatectomy. Let's start with TURP. This procedure is one of the most commonly performed to treat an enlarged prostate. A surgeon inserts a scope into the tip of your penis and up to your prostate. The surgeon then removes or resects part of the prostate that's causing the blockage. Sounds intense, right? But the goal is to make urination easier and relieve symptoms. Now, on to prostatectomy. This is a more extensive surgery where the entire prostate is removed. It's usually reserved for the most severe cases or when the prostate is significantly enlarged. This is a more involved procedure and usually requires a hospital stay of a few days. But remember, these surgical options are usually considered as a last resort when other treatments have failed. You might be wondering, why is that? Well, as with any surgery, there are risks involved. These can include things like infection, blood clots, or issues with sexual function. It's important to have a thorough conversation with your healthcare provider about what these risks might mean for you. On the flip side, surgical treatment can provide significant relief from symptoms. It can greatly improve the quality of life for those who have been living with severe symptoms and have not found relief from other treatments. In conclusion, if you're considering surgery for an enlarged prostate, it's crucial to weigh the potential benefits against the risks. Each person is unique, and what works best for one person may not be the best option for another. Remember, it's your body, and ultimately, the choice is yours. Your healthcare provider is there to guide you and provide information, but the final decision lies with you. Though surgery is a more invasive option, it may provide the most relief from symptoms. There you have it, a comprehensive look at enlarged prostate treatments. We've navigated through the maze of options available, from lifestyle changes that include diet modifications and physical activity, to medications that can effectively manage symptoms. We also delved into the realm of minimally invasive procedures, exploring how they can provide relief with less recovery time than traditional surgeries. And yes, we did not shy away from discussing surgical options, understanding that for some, this may be the most suitable course of action. The journey to managing an enlarged prostate can seem daunting, but remember, you're not alone. There's a broad spectrum of treatments available, each with its own benefits and considerations. It's about finding what works best for you and your body. Remember, early detection and treatment can significantly improve quality of life. If you found this video helpful, please like and subscribe. Stay informed, stay healthy.